I will discuss 5 reasons why children with autism may show aggressive and other problematic behavior and how to manage them. Many children may show high degree of irritability, which is characterized by physical and verbal outbursts, temper tantrums, meltdowns, destruction of property and self-injurious behavior. So first step in the management of aggression is to find out the root cause of the aggression. You can use the ABC model of the behavioral therapy. A stands for antecedent, that is the event that happens just before the aggressive behavior. Second is the behavior, make a note of the kind of the aggressive behavior. Number third is consequence, what happens after the behavior. You can modify the behavior by either removing the triggers so that the aggressive behavior doesn't happen, or by changing the consequence with proper reward and punishment. You reward the child for good behavior and you punish the child for bad behavior. Punishment has to be immediate, it has to be consistent, and it has to be something which is discomforting for the child, like removing his favorite toy. Here are the 5 common scenarios that may cause the aggressive behavior. Number 1, attention seeking. Children with special needs may not express exactly what they want. They may have a language delay, they may also have an intellectual delay. Many times when there is a newborn in the house, or there is a major change in the family dynamics like job change, city change, house change, or a divorce, parents cannot give enough time to the children. If the child is showing aggressive behavior as a way to attract attention, make sure that one of the caregiver spends enough time with the child to give the time, attention and love that the child is seeking. Many times it is not easy. Try to take help of other family members. Number 2, communication. Many children with special needs, they are not exact. Many children with autism spectrum, they have language delay and they are not able to communicate their needs. Make sure that you help the child to express his feelings, express his needs. If the child has language delay, discuss with your speech therapist, use picture cards, use electronic device or sign language. Do not wait for the speech to come. Open the channels of communication as soon as possible. Number 3, learn violence. Children with special needs may be also exposed to violence at home. They may be exposed to violence at school or the daycare or their therapy center. As they interact with other children with special needs, some of whom are more severe, they may also learn some bad behaviors. In this scenario, talk with the school teacher or talk with your therapist to find out ways where you can minimize the exposure to violence. At home, make sure that you do not hit the child, do not spank the child, no matter how bad the situation becomes. You want to stay calm, composed and be a good role model for your child so that he can learn healthy ways to deal with anger and frustration. Number 4, ADHD. Attention deficit hyperactivity disorder is very common in children with autism. Hyperactivity can manifest as problematic behavior, aggressive behavior, restlessness. If that is the case, try to make changes in the diet, eliminate sugar, eliminate artificial colors, eliminate gluten, eliminate dairy. Try and see which diet works best for your child. Sometimes in spite of all the dietary changes, the problematic behavior may persist. In that scenario, consider treating the ADHD with medications. Today I will discuss some of the common scenarios which can make children with autism show aggressive and other problematic behavior and how to manage them. Sometimes children with autism may show problematic behavior like biting, scratching, kicking, pushing, banging head, destroying property, endangering their life and also endangering the life of others. These are very serious situations. Do not wait, take professional medical help as soon as possible. Now I will also talk about some general things that you can do to help the child with aggressive behavior and hyperactivity. Make sure that the children gets enough sleep at night. 9 to 10 hours of sleep are absolutely required for children to function properly during the daytime. Keep a fixed structure and schedule for the child. Make sure that the child goes to bed. Make sure that the child goes to bed. Make sure that the child goes to bed at the right time so that he gets enough sleep at night. Also make sure that the children gets enough exercise and outdoor exposure during the daytime, so that by the evening time they are tired and they get a good night's sleep. In addition, if the hyperactivity persists, you can also consider using weighted vest or weighted blankets. They can be calming and have a soothing effect to the child. They may have a calming and soothing effect to the child. You can also use the supplement magnesium for the children. Magnesium has a calming effect. You can use magnesium has a calming effect. Magnesium citrate and magnesium glycinate can help with the hyperactivity in the children and can also help with the sleep. In case of severe aggression which is not controlled by therapy and other measures, do not wait, seek professional medical help. Medications may not be the best way to control the symptoms of aggression in children with autism, but they may help you to buy time. Sometimes the aggression becomes very worse, and when the children grows up, I have seen parents bringing 16-year-old, 18-year-old teenagers in my clinic who are big and huge, and when they become aggressive, no family member can control them. Sometimes they have lashed out, they have hit family members, they have injured their teachers. This can have very serious legal consequences too. It's very important to treat and manage the aggression early on before it goes out of control.